Okay guys, so this is to do with your task 5. Thank you. Task 5, all right, where you have to interview a care worker who works with people with challenging behaviour. Now this was going to be Dr. Isabel Clare. Unfortunately she can't make it, she's not well. So I've worked with people with challenging behaviour, so it's me. Alright? So you should all have written questions. Have you all written your questions? Okay, you all knew about that you needed to write the questions. Okay? Okay, fair enough. Okay, well, what we're going to do is, as you can see, we're videoing it. And we'll make the video available. I'm not too sure how. Tim, do you happen to know if we can put this up on Moodle or anything like that? Or okay, brilliant. So it should be available to you. Okay, so we're videoing it. The plan is I'm going to do a talk, and you can, based on the questions you've written, you can see whether that's answered your questions, and then there will be gaps. Or there will be things that you need to find out more about. So at the end of it, I'll open it up to questions, and you can ask questions at that point to fill in any gaps. So you then should have answers to everything that you need to have for this task. Is everyone okay with that? All right? Groovy? Groovy? Groovy. Right. Okay, so challenging behaviours. Challenging behaviours, that's what we're talking about. I'll give you a bit of... My experience was, I worked in 2 care homes that had service users who lived there who had challenging behaviours. And in the talk I'm going to tell you what that means, what the terminology means, some of the problems with the terminology. We're going to talk about kind of what interventions we used and how we supported people with challenging behaviour. So I did that. I worked with people in 2 care homes who had challenging behaviour. I also set up a day centre or day activity routine for people with challenging behaviour. And then I worked with older people with Alzheimer's who also, some of the people that lived there also exhibited what might be called challenging behaviour. All right. Okay. No. Not this way. Okay, so now there's 2 different terms that people might use in this situation. One is behavioural difficulties, and the other one is challenging behaviour. Neither of which of those terms I'm completely happy with, because whose is the challenge? You know, what does that mean? Challenging behaviour, what does that mean? Is it that the behaviour that a person exhibits is some way inherently challenging to other people? Or is it that their behaviour means that staff have to challenge what they think about? Is it they have to challenge how they're providing their service? Ultimately, it's quite a problematic thing. The most important thing, as I'm sure I've told you all before, is to think about individuals before you think about anything else. Each person that might fall into this little subsector of people is an individual and should be treated as such. Okay. So what do we mean by challenging behaviour? Things like violence. Things like antisocial behaviour. I've told a few of you about a client that I worked with who used to spit. And you know, would spit at people. That's antisocial behaviour. Behaviour that goes against a social situation, so it stops people from being able to. Hi Leanne, you're going to have to grab a chair from in D7. rebelliousness. These are definitions as to what challenging behaviour is. You may find that as we go through this, you think to yourself, well, that's not challenging behaviour. Rebelliousness, you know, that's not, how is that a negative thing? And what I'm saying about challenging behaviour isn't necessarily a negative thing. It's about individuals. I like this. I like people to have this. You know what I mean? Because this challenges things and helps people to make things better. I like rebelliousness.
Yeah. You might need to bring some chairs in. Depends how many people you've got.
Untrustworthiness. Withdrawal. So people taking themselves away.
What do you mean by the untrust? That's what I was thinking.
So not doing what
Who do you mean it from? Like?
service users. That's what this is. That's what these
So what,
definitions.
them not trusting you?
No. Them being so being asked to do something and then them not doing it.
Them being untrusting.
Yes, untrustworthy.
But then maybe just shouldn't allow them to live under that old.
Well, that's what I'm saying. Really, these are not my definitions. These are clinical definitions, and I would like you to challenge these things. You know what I mean? I think that one particularly is something that I think is you can say, well, what exactly does that mean? Do you know what I mean? These are not things that I'm saying. These are things that are put out as being what challenging behaviour is, and it gets worse. Stereotype behaviour and odd manner. Worked with a number of service users who have kind of odd mannerisms. I've worked with lots of students who have odd mannerisms, to be honest. In fact, some of them are in this room right now. But it's, you know, again, it's kind of exactly who is that a challenge to, really? Why is that a problem for people? And it's just, like I said, I want you to think a bit kind of closely about what that means, because, and we'll come back to that later in how that affects how you're going to work with people. Inappropriate interpersonal manners. Worked with a service user who would, he met you for the first time, he would just throw his arms around you, and then spend the whole time trying to give you a cuddle like that. That is quite challenging. That fly's getting on my mind.
No, kill it. Fly.
That fly has challenging behaviour. Unacceptable or eccentric habits. Self-abusive behaviour. Please, if you don't understand what these mean, please ask me. Worked with a service user who had, who used to kind of repetitively push her thumbs into her cheeks. Doesn't sound that bad, does it? Because she'd been doing it for 20 years, she had huge sores on her face, which would get infected and things like that. Can you see how that's not challenging? But the fact that it caused her health issues then became an issue that needed to be addressed. Hyperactive tendencies. And sexually aberrant behaviour. Everyone okay?